And he has over 20 years of experience holding managerial positions in the sector. And as you all know, he's a Thomian. He holds a doctorate in business management from Malaysia and a master's degree in business administration from the University of Western Sydney, Australia, a certified professional marketer from the Asia Pacific Marketing Federation, and holds a postgraduate diploma in marketing from the Sri Lanka Institute of Marketing, has a membership in long list of professional bodies and federations. With that, I just want to justify one reason why we have selected Doctor for this discussion is Dr. Piris was appointed by the Ceylon Chamber of Commerce as the lead to formulate the 2025 health sector strategy in contributing to the Sri Lankan economic acceleration. At the same time, with this pandemic situation, he was also the lead in crafting the post-COVID recovery plan for hospitals. So with that introduction, I will pose the first question to you, Doctor. As laymen, we really don't know how this hospital or the healthcare sector operates. So as we know, the healthcare industry is a complex and an important industry to keep Sri Lanka and our people healthy. We would like you to request to share some insight to the Sri Lankan healthcare industry, mainly focusing on the hospital sector. Over to you, Doctor.
Okay, thank you, Doctor, and a very good evening to all the participants and all the speakers. So to answer your question, over the past decades, the Sri Lankan healthcare system has achieved much better health indicators and coverage when compared with the neighboring countries at a lower cost and higher standards. Now, although Sri Lanka has notable achievements in terms of controlling communicable diseases, continued efforts are needed to control commonly occurring epidemics such as dengue, influenza, and to prevent the insurgence or resurgence of already controlled contagious diseases. It is noteworthy to understand that Sri Lanka was also declared as a measles-free country by the WHO in July 2019. A recurrence of dengue and influenza epidemics were observed during the first half of 2019, and the dengue prevalence was 120 per 1,000 persons during the first half of last year. So with the changes in disease patterns and the rising income levels, households were increasingly relying on private healthcare services, particularly in a backdrop of a tight fiscal space that limits government expenditure on healthcare sector. Now, this was pre-COVID. So therefore, we predicted before the pandemic that the government will be strengthening the regulations on private healthcare providers to ensure quality and affordability of services. Another significant area is CKD, or better known as chronic kidney disease, continue to be a major health issue, particularly in rural areas. We also saw opportunities in public-private partnership to provide access to quality, affordable healthcare to masses and to reduce the burden of the public healthcare system. So let me give you a glimpse of some key public healthcare statistics we have. For example, if you look at the government sector or the public sector, we have over 21,000 doctors. So that's about 1 doctor per 1,100 patients in Sri Lanka. There are 613 government hospitals with 768,000 beds, which is 3.2 beds per 1,000 persons. We have 36,700 nurses, again 1 nurse for 648 persons. We have 114 government Ayurvedic hospitals with a bed capacity of about 4,900 and 25,000 registered Ayurvedic physicians in the country. So these are some of the public statistics for the benefit of the audience. Now, if you take a closer look at the private healthcare statistics, we have about 200 odd private hospitals with a bed capacity of over 5,000 beds. There are 265 medical labs, 129 medical centers and channeling centers in the country, and about 330 part-time general practices or dispensaries or medical clinics. And once again, if we look at the pre-pandemic or the pre-COVID era, during the first half of 2019-20, the hospital industry indicated about a 5% overall growth when compared with last year, which is a very small growth. The low growth was due to the 1% growth recorded in Q1 and Q2. But however, the hospital industry was able to, improve thereafter during the balance 2 quarters. The low growth was mainly due to the Easter aftermath of the Easter bombing. Now, let me also highlight some of the interesting facts for the benefit of the audience here. The elderly population of 2.4 million in 2001 increased to about 3.8 million in 2018, that is representing 17% of the country's total population. Now, by 2041, it is predicted that 25% of the population is expected to be elderly. Now, this builds an increasing demand for the specialized healthcare needs for the elderly. Then again, rising incidence of non-communicable diseases, better known as NCDs, such as diabetes, cardiac, cancer, and chronic respiratory diseases are on the rise and accounting for nearly 75% of hospital deaths in this country. So NCDs have thus emerged as a serious economic and public health issue and is further aggravated by unhealthy diets, sedentary lifestyles, and the use of tobacco and alcohol. Another area in the hospitals or the healthcare industry that we need to focus is medical and wellness tourism, which is seen as a worthwhile investment, especially due to the strengths of our country to be transformed as an emerging healthcare hub in the region. And another interesting fact in the healthcare industry is that non-healthcare businesses are eyeing to enter the healthcare sector through digital healthcare solutions, especially tech companies. So therefore, the traditional and rigid hospital operating models should relook at their offer to make sure that they create an entire ecosystem around their core clinical activities. The healthcare industry is also grappling with shortage of skilled professionals, including doctors, specialists, qualified pharmacists, nurses, then technical staff. We also see a rise in medical insurance penetration in future in this country. And with free universal healthcare embedded into our constitution of Sri Lanka, healthcare system is widely recognized in the world as a country providing high quality clinical services and accessibility to healthcare. So in Sri Lanka, we need to understand our market is a mixed market dominated by the public health services. Now, the private health sector makes a significant impact on the country's healthcare. This sector is a conduit. I would define it as a conduit for introducing innovations in healthcare to the country, ensuring Sri Lankans have access to high quality diagnostic treatments necessary to facilitate healthy living. Continuous focus on high standards and process efficiencies has driven the private healthcare sector to be on par with regional players at a fraction of the cost of healthcare in the Western world. So during last year, all private hospitals recorded a weaker EBITDA margin compared to the previous years. Like I said, especially due to the slowdown in the revenue compared to our operating costs and the economic slowdown affected by the 21st April Easter attack. However, due to the agility and the flexibility of the industry, the sector recorded a noteworthy growth. So this is a synopsis about the healthcare industry, and I hope I have given a fairly good insight to the hospital industry.
Thank you very much, Doctor. Yes, you have covered a vast area, and it was new knowledge for us. Thank you so much. Thanks. With that, I will move on to Chandana Kanangara. He's an engineer by profession, and he's a chief engineer heading the engineering division of Cinnamon Lakeside, Colombo. Previously, he was working at Cinnamon Grand, and he has more than 15 years experience in the hospitality industry. And he's a MBA holder, as well as he's reading for his doctorate at the University of California. And he possesses overall experience and knowledge in facility, environment, health and safety, sustainability management, property and maintenance management, project management, so many other areas, diversified areas. And the research area that he's capitalizing right now is impact on green innovation, on corporate sustainability, and to be awarded the doctorate very soon, I guess. With that introduction, Chandan, I'd like you to touch on this the hospitality industry situation like before the COVID pandemic, that is pre-COVID situation, how you all were performing, and the impact. Of course, we know that there is a serious impact for the industry, but how significant the impact, and your remarks on that, Chandana.
Yeah, thank you, Rajan. Thank you for your kind introduction. And first of all, I would like to thank the BA University of California and board members and team members who organized this fantastic event today as knowledge sharing platform, which is very much needed for current business operation context. And so coming back to this post pre-COVID situation, Ranjan, what I would see is when we focus on to the global context. So what we see is globally, based on the latest statistic produced by the World Travel and Tourism Council. So what it indicated that 10.3% of total GDP contributing to the global travel and tourism sector. And when you look at the employee population of the global, the 330 millions of the jobs are representing global travel and tourism industry. And if you see, once in every 10 jobs also representing the same industry. And when we see about global economic growth, so it indicated that 2.5%, and whereas the travel and tourism growing significantly more than 3.5%. And also when you look at every 1 in 4 new net jobs also emerging from the travel and tourism industry. So if you see the global perspective, what we have seen is there is a kind of a incremental economic and employment growth in the industry. And also in similar context, if you focus on the Sri Lankan context, what we have seen is the travel and tourism industry is contributing to 10.3% of GDP contribution. And we are talking about 903,000 worth of employment population representing in the same industry. And the travel and tourism is third largest foreign exchange income generator for the Sri Lankan economy. And also what we see here is year on year there is a occupancy growth as well as tourism arrival growth we can see in the industry. And till about 2008, there's a significant economic growth in the industry, but 2019, what we are seeing is due to the Easter Sunday attack, they also dipped in the economic development in the market. And if you compare with the year 2018 statistic versus the 2019, we can see the revenue drop of 4.3 USD billions against the 3.6 billion US dollars. So there, what we are talking about, 0.7 billion US dollar drop because of this Easter Sunday attack was during the period of 2019. So, but we were able to recover the industry more than what we have anticipated towards the end of the year. But when this COVID pandemic rise in the China and the sub-Earth country, what we have seen is during the first part of this year, significantly our tourist arrival has been brought down less than 30%. And with that, when we encountered the first station towards the mid of the March this year, and when Sri Lankan government imposed curfew and then the other restrictions, some of the hotel actually they decided to do the limited operation of the industry, and some actually basically decided not to continue the operation on a temporary basis. Considering the three main elements, I would say, particularly to support national and international initiative. And the second thing is to considering the health and safety of all our stakeholders, our employees, customers, and suppliers. And third is, when it comes to the hotel, the brand image is one of the important elements. So for the short-term and long-term business purpose, so our brand image is something which is very much important. And considering to safeguard our brand image, some of the hotel, as I said, temporarily they have shut down their operation during this period of time. Yeah.
Thank you, Chandana. I take this opportunity to remind our viewers that we are live on YouTube as well as Facebook for your viewing pleasure. With that, I'd like to move on to our next panelist speaker. I will tell you, we are moving from one industry to the other, the service sector, but from the healthcare sector to the hotel sector, now education sector. I think something that we have not put that much of a inquiry into the education sector. I will introduce next speaker, Kusala Fernando. He's the principal of Prince of Wales College, Morutua. He's a graduate from the University of Northumbria, UK, and he has a master's degree from Cardiff Metropolitan University. And the significant fact that I've found out about Kusala is that his achievement as the president of the first ever General Assembly of Commonwealth Youth Council in 2013. He was also appointed as the first ever male youth representative of the Commonwealth Advisory Body on Sports from the Commonwealth countries in 2011. And he also heads the steering committee of the National Steering Committee of to formulate National Youth Policy of Sri Lanka, a member of the Working Committee to establish Professional Youth Workers Association of Sri Lanka. And due to his wonderful achievement, Kusala was named as one of the Commonwealth Young Achievers of the year 2015. With that introduction, Kusala, I'd like you to touch base on this so-called transformation of traditional classrooms to online platforms. We talk of the online classrooms. Can you elaborate a bit on that and how successful it is right now?
Thank you very much. Good evening, everyone. Actually, due to this COVID-19 pandemic, we have to transform the traditional classroom into digital or online classrooms. That is one of the major changes occurring in the education industry during last few months. Actually, when we consider about the pre-COVID pandemic situation, teachers, some of the teachers, school, I'm referring to school teachers, they don't have the competency in technology to conduct online classes. But anyhow, now most of them, doing day-to-day basis. They are doing online lectures for students, and now they are more familiar with technological tools, and now they are more familiar with the IT-related tools, and now they are more technically competent. That is one major changes. One of the major changes occurred in the industry, and also after this pandemic, actually, when after this pandemic have grown as a big issue, most of the teachers, as you know, that most of the schools around the world were closed, and teachers have to find, or the colleges or the schools have to find ways of collaborate with students with their studies, and students also find it difficult because when we consider about Sri Lankan context, we are about to have the first term test at the middle of the month of March, but on 12th of March, Minister of Education of Sri Lanka decided to close down schools due to the rise of this pandemic situation. Then after that, due to the school closure, teachers have to find ways of covering the lessons which they're supposed to finish within the first term of study of this year. And initially, Ministry of Education actually closed schools until 21st of 22nd of April, which they actually the planned date for the second term starting, and after that they also postponed that date. Now schools will start on 6th July for the grade 13, 11, and 5, and after 2 weeks, grade 10 and 12 can go to schools, and then except grade 1 and 2, all the other grades can engage with school education again after 27th of July. So this traditional classroom actually transformed to an online classroom during last few months. So with that, so many positive things happened. One is that the IT literacy of teachers enhanced, and IT literacy of students also enhanced. As you know that Sri Lanka, when we consider about Sri Lankan computer literacy rate, it is, according to the statistics in 2019, it is 30.1. And it is low among, especially among the younger ages, maybe mostly when we consider about grade 6 to 10, our students' computer literacy is low. But anyhow, during last few months, many of these schools were able to engage with teaching learning process. They actually adopted various tools like Microsoft Teams and Zoom and those kind of stuff. And many schools use social media like WhatsApp, Viber, and even YouTube, and they conduct lessons. And now, due to this teaching learning process through online tools, teachers and students enhance their IT literacy during last few months. And now teachers can, they are able to conduct lessons using online tools, and it helps them to actually to conduct lessons very effectively and efficiently, For example, now science teachers, they can show videos through these online tools, through online apps, and students can more understand more about the concepts and some of the very important areas of study easily by watching videos and referring various tools which they can use online. And also I think parents also have done a big role during last few months. Some of the parents, they actually not allowed to use they not allowed their children to use what you call smartphones, or go to internet before in pre-COVID situation. But after this pandemic happens, parents actually, due to this online education happens, then parents allow students or their children to engage with online education through social media, and also they provide many parents provide necessary IT facilities for their children, and they allow their children to use smartphones, laptops, and use various IT-related tools to engage with these online lessons. Therefore, students were able to use online tools, and they now familiar with many of the online tools, and they know that there are they understand the value of these online tools during last few months. And therefore I think it's very positive thing. And also there are many more negative things as well, like some of the teachers and students, they don't have access to internet, they don't have facilities. Some of the teachers and students, they don't have a smartphone, they don't have internet or data facilities, and also some of the parents, they actually lost their monthly revenue due to the COVID-19 pandemic, and as a result of that, they don't have enough money to actually to buy internet connections or allow their children to engage with these kind of online interactions through internet, because they don't have money to pay for that. And also therefore I think that inequalities in education systems in many countries, especially in the third world, and also in many of the developing countries, further widened due to this pandemic situation. And also teachers also find some kind of difficulties, because as you know that even though they have conducted some of the lessons through internet and using some other tools, there are some students who can't engage with this online education. Therefore, after school starts, they have to they can't let them go, and they can't let those students go, and they have to that give their they have to conduct lessons for those students who couldn't engage with the online education during this pandemic during last few months. Therefore, these kind of negative aspects also there. Anyhow, I think this traditional classroom transformation to online platforms and to an online classroom, we can take it as a challenge, but we can change it as a positive thing, because many of the teachers, they now they are willing to use technology for their teaching learning processes in the future. And even some of the schools, I know that they are preparing some lessons. They are preparing learning management systems for students, and through those platforms, I think online education facilities will be enhanced, and it will good for the education systems. Therefore, I think this transformation can be taken as a positive thing.
Thank you, Kusala. Thank you very much for sharing your thoughts on that. And I hope that you will give ample time for these students who have not got the opportunity to, learn these online lessons for them to study and get ready for their exams. With that, I will move on to another specific area. Doctor, I had to slightly change my question by looking at the questions that I've received from our viewers. I think there are a few interested parties who are trying to write this as a success story in Sri Lankan context. And the question that I have for you, Doctor, is hospitals were identified as a very risky places during this pandemic, no wonder. And you all were identified as essential service as well. And how did these hospitals and the industry as a whole took this challenge of safeguarding your employees, the healthcare workers, and the patients? When we see, when you look at the things that we heard in other countries, especially like in China, the doctor in charge of the hospital couldn't save his life. That was the situation in China. So I want you to comment on that, sir.
Okay. So during the pandemic, as healthcare workers, rightly like you said, our prime concern was to protect and safeguard the doctors, caregivers, healthcare workers, our own staff, patients, the community, and everyone who walks through hospital doors in order to provide safe, top quality healthcare services for those seeking medical assistance. So therefore, we had to take very stringent measures to mitigate all risks as much as possible. Now, in doing so, we had to put together an action, well thought out protocols, also shared by the Ministry of Health, the Epidemiology Unit, the WHO, and further strengthened by experts in the field of infectious diseases. Now, both government and private healthcare institutions had to put in place a robust governance structure comprising of steering committees that assesses the country's situation and new developments on a daily basis, engaging with all stakeholders such as the National Operations Center for Prevention for COVID-19 outbreak, like I told you, the Epidemiology Unit, the MOH, and also the Private Hospitals Association, etc. Now, during the pandemic and the lockdown, the hospital revenues were down by 70%. Doctors did not want to see patients due to the risk of exposure. And the patients did not want to risk themselves by walking into hospitals due to the risk of exposure again. Then we also saw that elective surgeries were indefinitely postponed due to the risk of to the patients and also to the healthcare workers. And also at that time, during the initial pandemic, due to the lack of PCR testing facilities in the country. However, the hospitals were quick to change their business model to provide services through digital platforms and via doorstep services such as teleconsultations, telemedicine, home care, home medical care, home sample collections for diagnostics, etc. Now, stringent processes and protocols were implemented by hospitals to safeguard patients, visitors, staff from the coronavirus infection and still, I want to reiterate, and still continues to be a part of a safety-centric operating model. Why I wanted to reiterate this word was that people now think that everything is okay and that they can do anything what they want, which is not the real fact. So whatever that I'm telling you right now it still continues to be a part of that safety mechanism. So let me highlight some of the key precautionary measures we put in place for the hospitals to continue to provide 24/7 healthcare services to people of Sri Lanka. Whilst the public hospitals were mobilized to handle COVID patients, the private hospitals provided access to routine healthcare needs. And some of the precautionary measures that we took were, number one, we introduced a patient declaration form to be filled by the patient on arrival. And then screening of patients to be carried out outside the main entrance of the hospital, and facilities were constructed for this purpose by hospitals. Then all patients were triaged. Those days patients used to just walk into a hospital. But then we started triaging all the patients, and according to the responses given in the self-declaration, were categorized into a risk matrix. So the COVID suspected patients are kept separately until the patient is transferred to a designated government hospital. Now, once again, I must tell you that private hospitals were not allowed to treat COVID patients, and the government designated 17 hospitals as COVID treating hospitals. So these are the hospitals that I mentioned. Then PPE, PPE is personal protective equipment, will be worn by the staff when transferring these patients. Transfer protocols have been established in our hospitals. High-risk category is kept in observation areas under CCTV surveillance, maintaining social distancing until a doctor with relevant PPE examines them in a separate examination chamber. Now, according to the clinical decision, medical and surgical patients who needs to be ruled out of COVID infection will be transferred to an observation ward inside the hospital through a secured pathway for COVID PCR testing. If the test result is negative, the patient will be sent to a normal ward of the hospital, and if positive, will, like I told you before, will be transferred to a designated government hospital. Then observation wards inside hospitals have been separated and restructured according to infection control and engineering guidelines. Separate protocols are developed for different clinical scenarios. For example, PPE use, disinfection and disposing infected material to prevent cross-infection amongst healthcare workers and the patients. Also specified locations were made available to provide ICU care for patients in line with infection control guidelines. And also hospitals such as HEMAS introduced online digital solutions to fill self-declaration forms on patients' smartphones before arriving at the hospital. So this safeguards the patients, or rather the staff, from exposure to COVID virus, and also we were able to assess the risk and the condition of the patient even before they present themselves to the hospital. Then hand washing facilities before entering to the hospital is provided just outside the entrance along with the hand sanitizers. Further tents, marquees and facilities were put up for the bystanders to stay because we had to reduce overcrowding within the hospital. We couldn't allow everybody to come into the hospital because sometimes we see that with one patient, you get about 5-6 relatives walking into the hospital. So in order to safeguard the community and everyone, we had to lay some laws and restrictions for the benefit of healthcare workers and the patients themselves. Then resuscitation and nebulization areas were fitted by air vents with HEPA filters. so that air within would not contaminate the rest of the hospital. Then uniflow systems for patients and visitors. The staff had been established where they enter through a main entrance and exit through another exit back door. Protocols for sample collection was established with recommended PPE and transport media. What else? Then processes to follow in relevant, so in the event an employee is infected or exposed to the virus with possible infection was established. Proper donning and doffing of PPE has been demonstrated to the staff and pictorial instructions displayed. Then staff has been instructed on home quarantine if a need arises, such as those with possible exposure. Then we also introduced home care visits, and also these home care visits were undertaken after establishing risk category based on the self-declaration, which is filled at the time of booking these services. Protocols were laid down for the hospital cleaning staff on proper surface and area cleaning of the hospitals. Until very recently, all patients undergoing general anesthesia for surgery were subjected to PCR testing. We don't do that because now the risk of COVID in the community is less. Then ultraviolet, we call them UVC, disinfection equipment is used to disinfect operating theaters, patient rooms, etc. Then another very interesting thing that the hospital started was batch rostering of staff. So what I mean is that we are a 24/7 operation. So if I get exposed, I cannot infect everyone in the hospital and for the hospital to close down. Hospitals never closed down. So what we did was 50% of the staff were on paid leave for 14 days. The other 50% worked 12-hour shifts. And at the end of 14 days, the current batch is replaced by the employees who were on paid leave. And this was carried out, like I said, to minimize staff exposure to infection. Then internal audits still is carried on to monitor adherence to all the protocols and the processes. So these are some of the stringent protocols followed by hospitals, HEMAs, as well as most of the other hospitals. Now, there were also huge cost increases due to very high consumption of PPE during this time. Personal protective equipment, the consumption was, fivefolds, it increased by fivefolds. Hand sanitizers and disinfections. There were added costs to facilitate employees to work from home in terms of ICT costs. Hospitals had to incur huge costs to create safe environments for employees and also to keep patients and the community safe. Employees had to be provided with free meals because they were staying within the hospital, in the hospital, because we couldn't release them to the community because of the risk of exposure to the community. Free transportation, pay them special risk allowances for the sheer commitment shown by staff during the pandemic. Had to focus a lot on staff welfare. For example, if I take the hospital that I work for as an example, we did not take the route of salary cuts for our employees. We also made sure that the staff were paid a part of the bonus. So these were some of the precautionary measures that we took, and also some of the very important welfare measures that we took, because rightly, like you said, we are in the front line. We carry the highest risk of exposure. So therefore, even though the businesses had to suffer a lot, like I said, the revenue declined by 70%, but still we had to focus on staff welfare to make sure that we provide our staff who have so much of commitment to protect our own country. So these were some of the precautionary measures that we took, very stringent protocols that we still adhere to. I hope I did justice to the question.
Yes, thank you very much, Dr. We learned a lot. I think if you all can practice these strategies, why not other organizations which are not that exposed to this pandemic? And with that, I will move on to the next industry, from hospital to hospitality. Chandana, I know during this lockdown, we found it difficult, spend day-to-day living and activities, and we were really struggling. How did you all manage your hotels during this lockdown period? Can you share your thoughts on that?
Yes, Ranjan, actually, so as you mentioned very correctly, it was very tough time for entire industry. And like as I said earlier, some of the hotel had to operate their businesses with very stringent protocol, with the support of medical health authorities and Sri Lanka Tourist Board support, and they continue to run their operation with very limited operation, because airport was closed down, and guests who were staying in the hotel has no option to go India and go back to their countries, and so as a hospital industry, so we can't let them down at that moment. So some of the hotel actually, they decided to continue their operation with stringent, very strict health and safety control measures. And as I said, some actually decided not to continue their operation, and temporarily they have closed down their operation, considering the entire support to deliver the entire support to government initiative, and thinking their the health and safety of the employee and the organization and everything. So during that period of time, Rajan, I would say our balance scorecard was not balanced at all. And when you look at the financial perspective, I mean, it's very, 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 very critical for the industry. And so what are the measures that what we have taken to manage that situation? And so we actually look at the weekly dashboard, and weekly we monitor our expenditures and control, and daily basis we monitored our expenditure, and there were kind of a hierarchical process. I mean, if you want to incur cost for our day-to-day expenditures, so we have to get that the right hierarchical level approval, and then we can go for our expenditure. And also when it comes to capex, the non-essential capital expenditure and stringent expense control were very seriously taken place during that period of time. So, and also some of the industries actually so went for a kind of a financial assistance for the financial institution, and then the government also suggested a certain moratorium, repayment loan, and concessionary working capital for eligible industries. And some of the hotel actually, they have to go for that, and so they have to manage their day-to-day operation during that period of time. When you look at the financial situation of the hotel industry during this pandemic period of time. And so some of the hotel, Ranjan, I would like to highlight it, because I mean, so essential practices was advised by the government during that period of time. So the opportunity what we had at the market, some of the hotel decided was to deliver the food what they are preparing at their restaurants, with collaborating with the leading taxi service as a collaborative business strategy, kind of a win-win situation. And also some of the group hotel, though they have kind of different restaurant, different the flavors like Chinese, Thai, and Japanese, and those the restaurants are there, different, the same chain of the multinational hotel chains. And what they did is, and they also took a kind of a collaborative business strategy, and they have marketed their all the restaurant as one the market strategy, and they were able to tied up with this the leading taxi service, and they marketed their restaurant portfolio during that period of time. And because in this journey, actually, some of the hotels, they have started this process very early, and those hotels actually they were able to get the first move advantages during this period of time. And also at the very beginning, the hotel who has started this food delivery services, what we see is at that moment, I mean, though we have regular customer for your Thai, the Chinese, or the Japanese food, because that period of time, your brand loyalty, I mean, has been shifted, because the customer had to go whatever the available product in the market, and they don't have any choice for them to select whatever the loyal product for them to select based on their requirement. So likewise, now what we see is now this delivery trend has been gradually we have seen that it has been shifted to again the customer now starting to come to our restaurant, and they have start to recognize that our restaurant. So right now our strategy, what I see is we need to focus our strategy based on the again in-room dining facility what we entertain during the pre-COVID period of time. So these are some of the financial challenges what we have faced during the COVID situation, especially when you look at this hospitality industry. And again, the other element, I mean, when you look at the people perspective. So actually, with as I said, some of the hotel we had to close down our operation temporarily, and some of the hotel we operate in kind of a restricted minimum operation condition. And we also need to carry out our day-to-day only the essential service, and especially so there were challenges for us to get curfew passes, arrange them transport, and likewise, and also more importantly change their mindset, because they are with some time their families, their parents, and then convince them to come for the work is actually, as a management, it's a kind of challenging role for them to understand the real situation, because they are also as a human, they are also scared of life safety. So we as a managers have a great the responsibility for them to convince why they should come to the business and to support us, and to continue this business for the further the development of this business is very essential. And we took that role to to convince them and bring them to the operation, very limited staff, and we were able to continue our operation during that period of time. And also so during that period, one of the other element is, I mean, because this hospital industry, we say that it's a people business. I mean, it's a kind of a people-oriented business, because a lot of people are engaging with the day-to-day business operation. The people who have not turned up for the work, actually, we had to engage them with the business, because we can't keep them isolation in their homes or wherever they are staying. So I think we had a kind of a regular meeting for them to engage with the business and what's happening in our industry, and day to day we had a online meeting with them to explain where are we leading and where are we heading on the business. And more importantly, Ranjan, what we did is we actually developed the COVID related SOP, because our standard operation process has been completely as Dr. Lakit very correctly explained. Similarly, in the hospitality industry also, we have to change our day-to-day requirement based on the COVID guideline. And more importantly, those day-to-day practices, the hand washings and hand sanitizing, and even when they come for the staff, dining. So especially that, by respecting the social distance norm, let's say if we have 4 people dining at the 4 table, and we have to limit it to the 2 people, dining at the same table. So likewise, and also the, the buffet layout. So what we did was, we had to provide the knees guard and all the safety precaution matters that we have, align with Ministry of Health guideline and as well as the sport guideline. And also one of the more important things what we have done is developing a kind of a rapid response planning. So it's very important in case if we detected, the suspected case, maybe from employee or maybe from guests, actually we need to have kind of the methodical, very stringent control plan, because how we are going to take that particular the suspected case to the isolation facility which we have given. and from there, how we are going to administer that particular suspect patient or the staff member. And not only that, and the requirement that we are supposed to provide for that, the isolation room in terms of ventilation, sanitary standard, and also the basic safety precaution, and also the ones we contact the health authorities once we dispatch the case. So it is very important for us to manage that situation of the cleaning the room, and what is the right disposal procedure that we should need to adapt that when it comes to the disposal of the waste and the cleaning the room, the safety precaution of the safety staff, and all those things. I mean, we have to very critically look at, and we need to develop our plan, and also we did a mock drill also to make sure that in case if we detected the suspected case, I mean, people should be very competent to manage that situation without leading to any complication or any spreading more risk the employee and business. And also one of the important things what we did is to develop our pre-opening plan and pre-opening manual. So I mean, we focus on to 10 days once we get the government clearance for us to start the operation. Prior to 10 days, we should actually what sort of activities that what we should do, and then after 30 days and the 60 days and 90 days, we develop our plan accordingly. How are we going to manage our businesses in each and every circumstance based on the occupancy demand, based on the business situation and the country situation, and also the health ministries and tourist board guideline. Also, they have been releasing time to time, because we had to adapt our strategy to manage the different circumstances which is they are produced in different stages. Also, during the pandemic period of time, I mean, staff awareness is one of the very crucial things, because I mean, since we are in a people business, I mean, every guest contact point, I mean, we have to stringently have the health and safety precautions, and the staff safety plays a major role on that area. And also, I mean, when it comes to hotel, it's a massive property, and managing our property is very much important. I mean, so our sanitary facility, the water and hot water, and also we consider about the air conditioning facility, and because we can't completely shut down our operation, though there's a kind of operation cost, because if we shut down our operation in a kind of a drastic way, there will be a kind of the later repercussion, because for us to repair and maintenance, it will be incurred huge amount of cost. So we actually went into kind of the balanced approach to manage that situation during that period of time, while managing those facilities, the sanitization standard, and we went to that kind of a balanced approach to manage our finance as well as our property in a kind of a balanced way. And also there are about plenty of equipment, so we need to make sure that all the equipment, though we have temporary shutdown of our operation, we need to make sure that if we get the green light from government anytime, I mean, we should be able to ready with the people as well as the equipment. Those things should be ready for us to facilitate with the operation.
Thank you, Chandra. Thank you for your thoughts on that. Let's move to the education industry. Kusala, I want you to quickly touch base on this the challenges that you all have as the administrators who are involved in the education industry. Briefly, can you share some of your thoughts on the challenges? Because it's difficult for us to learn. We are not in direct contact with the administrators as far as the education system is concerned. Please.
Actually, during the pandemic situation,
Kusala, I think your mic is muted. Okay.
Sorry.
Okay.
Yeah, actually, during the COVID-19 pandemic, we have come across various kind of challenges. One is the major challenge was lack of resources, not only for the schools, but some other higher educational institutes also find it difficult to have IT infrastructure required to conduct online or the virtual classrooms, and also sometimes institutes lack, they don't have the expertise to conduct classes. They don't have IT experts or experts in technology to provide the supportive roles, supportive the support for the online classrooms. And also some of the institutes, even they have the human resource, some of the educators, teachers, and also when we consider about the higher education institutes, lecturers, some of them are not familiar with some of the online platforms. So it took some time to actually address that challenge. Some of the institutes, they collaborate with some other same kind of institutes. For example, some of the universities, they collaboratively conduct some of the lessons, and they actually conduct some collaborative measures during the pandemic. And also some of the institutes, they shared the infrastructure facilities they have to conduct online classrooms, and also they shared the human resource and the expertise knowledge they have with other same kind of institutes like schools and higher educational institutes, and to mitigate that challenge. And also apart from that, when we consider about higher education industry, some of the students actually they completed their studies in universities before this pandemic arises, but after this pandemic happened, they couldn't, they find it difficult to find internships, because internships are partial or the part of their degree programs. To complete the whole degree program, they have to complete the internships. So some of the students find it difficult to find internships, not only in Sri Lanka, but when we consider about other countries, the same situation happened. And due to that, they actually, some of the students, they supposed to complete the degree programs in May or June in this year, but now they have to wait until they complete the internships. And first of all, they have to find internships, and some of them, even now, they couldn't find proper internships which suits for their degree programs. And also, due to this pandemic, another challenge was when we consider about the higher education institutes, lack of foreign research opportunities, because as you know that research is very important for higher education, and some students, they prefer to go outside their home countries to engage with research, and some of the UK university, some of the undergraduates, they actually supposed to come to Sri Lanka to engage with social work and some kind of similar activities for few months, which is a part of their degree program. And now actually due to this pandemic situation, they find it difficult to complete those kind of activities. And also another challenge was psychological disturbances, because as you know that due to this pandemic, suddenly all the educational institutes closed, and actually it badly affect the mindset of students, because some of them actually they have their life plans, and they wanted to complete their degree programs and other educational programs. They have timelines, and they have some higher educational plans in the upcoming months. But due to this pandemic, some of their educational objectives couldn't met during last few months due to this pandemic situation, and it psychologically affect them. And also, as you know, that due to school closure, you know that students in the primary classes, especially, they when we consider about primary students who are in grade 1 and 2, they actually they like to be with their parents, and they like to be with their families, and school is a new thing for their life. But once they are getting used to it, suddenly schools closed, and now again they have to be familiar with the processes. So it also have some kind of psychological disturbances. So that is one of the another challenge that they have we have to face in the
Thank you,
education.
Kusala. Thank you so much. Thanks. Now I'm come back to you, Doctor, again. I'm expecting a quick answer for this question, yes or no. The question is the pandemic over?
No, the pandemic is over, but we are still in the COVID era. We are not in the post-COVID era. So everyone has to keep that in mind.
Okay, next question, Doctor. I've collected from the question that I got from viewers as well. This is about your, like, now we talk of this new normal, and what strategies are in place to actually gain quick recovery of the industry. That is one. And I want you to touch base on the present situation and the way forward as far as the general public is concerned. That's us. How long we have to be like this under this precautionary methods? Your thoughts on that, sir?
Okay. So during the pandemic and the post-pandemic in Sri Lanka, I think consumer lifestyles, buying behavior, usage habits have all undergone significant change. Consumers, I think, across the globe have signaled a significant change in the usual consumption habits and health-seeking behavior, which may, I again reiterate, which may prevail in the post-COVID era. So these new behavioral trends are predicted to stay on, like I said, even after the world moves beyond the impact of COVID-19. So these changes will surely make a significant impact on our businesses, our family units, the consumer lifestyles, etc. Now, due to the uncertainty of the lack of knowledge of the new normal, every sector will have to carry out extensive research to understand as to what businesses should do during the post-COVID recovery and what it should do to take advantage of the new normal. So I have personally seen significant change in consumer behavior during the last 2 months when compared to the pre-COVID era. And what's interesting is that the behavior keeps changing at a rapid pace. Now, during the lockdown, we saw a huge demand for digital online services such as teleconsultations, telemedicine, then on the online pharmacy delivery, and also for home services such as home medical care, home sample collections for diagnostics, etc. Now, however, when the curfew was lifted and the spread of COVID became less threatening and transportation became normal, that high demand for digital and home services gradually declined. However, we now see a significant number of consumers still using these new services, and this change in consumer behavior we are witnessing as of now is probably the new normal. Now, you and I actually did not expect a lifestyle or a livelihood or economic disruption of this magnitude as a result of a health crisis. Same way, businesses were also not prepared for this. The BCPs, we call the business continuity processes, were not stress tested enough, and most corporates were dependent on the leadership and the agility of its management in facing the crisis. So most corporated act swiftly to cut down costs by way of salary cuts, then better control on manpower and administration costs, process re-engineering, while the SMEs, the small medium enterprises, which is we call the lifeblood of the economy, was at risk of closure. Now, the result of all this is a much smaller wallet of the consumer with less disposable income, where the consumer is now forced to make tough choices due to less earnings. So the businesses now have to compete on a shrunk wallet of the consumer. And it is also assumed that the Sri Lankan consumer intends to continue their price cautious behavior even after the crisis. So the companies will have to face a challenging task in redefining their value proposition of their brands to a more price sensitive market. And I was actually going through an interesting piece of research on Sri Lankan consumer habits after post-COVID-19. I think it's very good for Chandana as well to understand the consumer habits of the pre-COVID era. And according to this paper, it said about 66% consumers will spend less on branded clothing, and another 66% will cut down on foreign travel. Then there is, if I remember right, 40% of the consumers will cut expenses on beauty products, and about 59% will reduce eating out at restaurants because they were so used to eating at home during the lockdown. And 34% of consumers will cut back on local leisure activities, and 39% will reduce their expenses on home electronics. I think this is extremely scary for the businesses. So we predict that the healthcare industry after COVID and the health-seeking behavior of people will also change. Now, for example, what I assume as the new normal is that, better hand washing habits and personal hygiene will become normal. Air quality and self-protection from germs will become big, right? People will want to be sure of medicine availability. You saw how our parents, my dad, right, had to really was very, very nervous about whether he will be able to buy his medicines. Unfortunately, his son was working in a hospital, but I mean that was the mindset, right? Older people may be scared to live by themselves again, so old age homes will become popular. People will want to consume more knowledge about health and infections. I believe that online purchases of medicines and essentials will be very, very popular post-COVID. People will not want to go to public places where there are large crowds. I hope that it happens. Demand for supplements and alternative medicine to boost immunity will become very popular. We have seen lots of video posts about, how these organic things that is grown in Sri Lanka boost the immune system. Then the old and the sick people will be quite reluctant to enter a hospital and would prefer to go to less crowded, smaller clinics to consult a doctor. I also believe that telemedicine will become more popular. Shops will need to focus on healthy air and that will not spread the germs. Chandana can educate us whether AC systems will need to have HEPA filters in future. Will people look for that? Then
Quick question, Doctor. Again, I'm getting some questions from our viewers. They are just asking me to check with you. How safe people to go for local tours these days? Very simple question.
Okay.
I think hotels are offering different packages. Chandana, you can comment next time when you get an opportunity. Doctor.
So I think number one we need to understand is that Sri Lanka has been very, very efficient in managing the pandemic and COVID-19. The leadership that was given by the president, the COVID task force, the healthcare workers, I think did an enormous, marvelous job, the armed forces, in controlling the pandemic. So what I have to tell you is that the threat of COVID being in the community is very less as of now.
Okay.
So there is no community spread as of now of COVID-19 because all those clusters were managed very efficiently. But the risk is still there, right? So therefore, you can go on trips, or you can visit Chandana's hotel for a weekend package, but you need to make sure that your basics are adhered to. Hand washing, wearing mask, social distancing or physical distancing as we may call it, right? Making sure that you don't touch your face, your eyes, your mouth, your nose, right? As long as you take precautionary measures, I believe life can be normal.
Thank you very much, Dr. Lakit Peris. Thank you very much for your thoughts. And now, Chandana, it's your challenge. I have seen quite a few advertisements coming out offering different packages.
Yeah.
So just want to ask you, like, how you have decided to manage people, the technology and the interactions, the challenges you all have as an industry, and also I'm trying to couple another question that I got from one of the viewers. What strategies you have in place to attract customers back to hotels?
Okay, Ranjan, just to ask Dr. Lakit questions also, but I would say, I mean, we have kind of a stringent guideline in the process, to make sure that our, the health and safety and the stringent control practices are, safeguard the guests, the experience in each and every element. And on top of that, Dr. Lakit very correctly highlighted. So, I mean, MOH and Tourist Board, I mean, they are in a kind of a very stable state to ensure that hotel, the practices and the policies are in terms of aligned with the world-class standard. Because right now, so with the government advice, I mean, we are in a kind of a very stable status. So within a few weeks, they are going to have a kind of the stringent international accredited audit they will be conducting in each and every hotel, and they will make sure that all the practices wherever we continue, so that will be in par with the international world-class standard. So that's the credibility as a hotel industry that we are going to produce to the Sri Lankan community, as well as the entire world who are willing to come to Sri Lanka. So I mean that element, of course, I mean from our end, actually we will take almost the maximum precaution, and also I mean individually, as Dr. Lakit very correctly highlighted, we have a personal responsibility to look after your the basic sanitation process, what we have very correctly highlighted. So, and also coming back to the question, Ranjan, now, so especially, I mean, how we are managing this situation right now is still, as we very correctly understand that we are in a kind of a business continuity operation mode. Right now, I mean, every one of us, focusing on this COVID-19 risk, and also as a business, we need to have a very, strong BCP plan related to our businesses, because if there's any other risk come to your business with the COVID, so we should have a kind of a very strong strategies to mitigate those risks also, because otherwise you may not be able to continue business very smooth manner what we have expected to build in your business in the future. And also the other thing is what we are right now focusing is the people management is very vital. And based on the government regulation and MOH regulation, even though we can bring a 30% of the employee population for the operation, and also we have kind of a limited operation, scale down operation right now to facilitate that we need less number of staff. And like in hospital, we also have a kind of a BCP teams in terms of, for an example, team A, team B, team C. So in during the operation, if something happened to the team A, let's say person A is infected or whatever, so then entire team we may not be able to send to the quarantine or any other the medical process. So whenever that happens, we have backup team to come and take over operation. Then we can manage the operation smoothly. And as I said, because right now we have kind of a limited operation, and we need a less number of people to manage the operation. And more importantly, what we need to focus here is training and development can play a massive role right now, because you have kind of a additional extra time, because our focus should be, it's not just managing the operation or not just managing the outlet. Right now, what we need is actually the revenue generated managers who can, look forward for the future challenges, face for future challenges. So, I mean, the training and development plays a vital role at this moment. And also, the people who should be more agile to the current business requirement to face that challenges. And also, their agility and then the move forward with the current challenges is very vital. And the other things what I would like to highlight is, so another important element is our banquet operation. Based on the MOH FRIDA guideline, now we have to limit our operation. Let us say, for an example, if we have 450 pax banquet room, with the respect to the current guideline, we have to bring it down, scale it down to 150 pax banquet operation. So there is a kind of a drastic revenue drop in our operation. So to cope up with the current business requirement, and we need to see that, I mean, our strategy in such a way that, we need to see the possibility of capitalize all the venues and all the venue what we have. We need to see the possibility of capitalizing those venues. And also, you need to really look at how we are going to upsell and cross-sell those venues in terms of ongoing and the future businesses. And the other important element, and what we should look at is right now.
Chandana, we can't see you, Chandana.
Yeah. Can you see now?
No, still not. Okay, go ahead, please. Sorry.
Yeah. The other important element is now, right now, we should basically focus on to the virtual event. And because we should actually move with the technology, and that is the future, and that where we can sustain in the future. And one of the other element is hybrid event, because let's say if you have kind of 450 pax function, so you need to have technology to facilitate 150 pax, and the rest also with the technology there should be a way to engage those people, because they are also going to be part of that function. So I think technology at this moment, they play a vital role in terms of efficiency as well as effectiveness, and also considered in the future areas. So especially what I want to highlight here is that when it comes to the technology, I mean, COVID itself actually from the small, the sensor tap, and it went up to the robotic level to the diagnosis of the patient and those things. But right now, those technology it has developed in such a way that guests can check into the operation without going for kind of a touchless operation, and your payment can be done with touchless operation. And for an example, let's say that if you want to go to the restaurant and dine, so you have given a kind of QR code. You just need to scan through your mobile, and you just need to see, and you can order your food menu based on the mobile app what you have. So likewise, technology also magnitudely adapted with the current the customer behavior to align with the current health and safety requirement. So I think those are the the TBS the requirement right now, which we are adapted with the current business situation. and also more importantly, when we look at the way forward, I mean, when you look at last 10 to 15 years statistic, actually, main purpose of the visit of the guest is for pleasure that they have visited Sri Lanka. And when you look at our, the country and the profile of the country, we have a more opportunity to market our favorite business in terms of medical tourism, elderly care areas, and also wellness tourism, Ayurvedic related, eco-friendly, natural related tourism. And those are one of the areas that actually we can focus on that. And also, Ranjan, the other key area is right now, the industries look at some of the blended operation model, because we actually predicted our occupancy will be, gradually picked up. Not, soon after we open the airport, they will not come, to our country, but gradually they start to come. So then you need to have a kind of, blended strategy, because we have, massive scale of asset. So how are we going to, utilize those assets for you to generate the revenue? So that's a vital market that right now we are looking at to, generate more business right now with the current, the business environment. So those are some of the strategies, Ranjan, as hotel industry right now we are actually looking at, and how we are going to, bring forward our business to the future.
Thank you, Chandan. There are quite a few questions I'm getting on this Zoom chat group. The questions that they're asking is basically the facilities, whether they can use pools, the common areas, all sorts of questions. I think it's advisable for you all to come up with an article or a document where the local tourists can follow those steps when they visit your hotels, just to remind you on that. With that, I will now move to the education industry again. Kusala, your final thoughts on the survival plan as far as the education industry is concerned. What are your strategies, Kusala?
Yeah, actually, after this pandemic is over, I think educational institutes, they have to prepare for the future, because future will be based on online education, and actually no institute can be isolated from that, because if they want to be competent in the market, they have to be equipped with facilities to conduct online lessons, and also they have to have online payment facilities, and also they should have a library and virtual classroom facilities, and maybe even schools now are having some learning management systems where students can collaborate with their other friends in school in online platform, where they can interact with their teachers and share their ideas. So therefore, education institutes should have those kind of facilities in the future to be competent in the market. And also they have to have a risk management process within the institute, especially as you know that when you're going to go online, the laws and regulations on intellectual properties and those kind of stuff will come in place. So institutes have to consider those facts. They have to concern those things, and they have to have a good risk management plan within the institute. And also they should have focus on obtaining required resources and finance, including the resources, including financial resources, which is essential to conduct online education, such as I mentioned you earlier, that some institutes, they have IT infrastructure, but they don't have IT experts to conduct lessons, and they don't have their teachers or their lecturers are not good at IT applications. So they have to give them training, and they have to, as soon as possible, find their training needs, and to cater to the challenges they face in the future. And also, they should have the other facilities, such as every institute will have to have proper high-speed internet facilities to conduct virtual interactions with students. And also, now with this online education come into place, traditionally, you know that teacher meets students physically at classrooms, and they interact with each other, and students and teachers can observe the habits and habits, attitudes, and behavior of students in the classroom. But now it will be more complex for teachers. They should have the competencies to identify the behavior, identify the habits of students, to read their minds, to enhance the effectiveness of teaching learning process. Therefore, maybe teachers have to be equipped with many new kind of knowledge. For example, they may have they should have some kind of knowledge on emotional intelligence. They should have soft skills to identify the students carefully and correctly, and therefore those kind of things have to be considered very carefully by institutes in the future. And also, when we consider about the industry, the industry, education industry, will be more complex and will be more dynamic in the future with this online teaching, and therefore the institute will not be limited to a particular area or particular country. The industry will be global, and therefore even the local institutes may have to compete with other institutes, other similar institutes in the region or in the global arena, especially for universities to survive. They have to attract international students in the future. They have to be competent. They have to benchmark themselves with other universities in the global context to survive in the market. Therefore, they have to inspect and evaluate their processes, procedures within their universities and institutes, and accordingly, they have to make changes, make reviews and make changes, and to cater to the changes in the environment and to address challenges in the future education industry. And they have to benchmark frequently with the other institutes in the market, and what are the tools, what are the online tools, and what are the techniques they used should be observed carefully, and in the local context they have to use them as well. And with that, I think you know that in schools or in educational institutes, basically we are focusing on developing skills, knowledge, and attitudes of students. Therefore, this with this online the transformation of traditional classroom to online classroom will be a great challenge in the future, because when we consider about skills and knowledge, yes, we can do that very effectively and efficiently if we have resources to some extent in the that context. But when we consider about attitude building, it won't be easy. As you know that even now we can see that some very educated people who engage with very respectable professions are also sometimes doing some wrongful things in the society. They are committing crimes, and sometimes they don't have good attitudes. Therefore, actually they came to this traditional classroom where teachers and students engage physically in the classroom. But in the online platforms, teacher cannot observe students 100%. Therefore, attitude building will be very difficult in the future, and it will be the one of the main challenges in the future.
Right. Thank you very much, Kusalo. Thank you so much for sharing your thoughts. With that, I have to wind up this session. It's almost 9:05. This is for our viewers and the Zoom chat group. I've got quite a few questions. What I will do is I will be forwarding them to the panelists, and I will get a feedback from them, and this will be posted with our YouTube clip. So don't worry, all these questions will be forwarded to our veteran panelists, and then I will get you the answers in due course. On behalf of the DBA University of Kelani, I take this opportunity to thank Dr. Lakit Piris, Mr. Chandana Kanangara, Mr. Kusala Fernando, for taking your time appearing here and sharing your valuable thoughts with us this evening. And we are hoping to continue these series of webinars in the future. And with that, I will conclude this session. Thank you very much. Good night.
Thank you, Randy.
Thank you. Thank you very much.
Thank you.